Good afternoon and welcome to Selecting and Implementing Multi-Factor Authentication, a webinar tweet chat combo from healthsystemcio.com sponsored by Imprivata. Just a little housekeeping before we get started. My name's Anthony Guerra. I'm the Editor-in-Chief of healthsystemcio.com and I will be your moderator today. We are having a simultaneous tweet chat hosted by our Managing Editor and Director of Social Media, Kate Gamble. You can participate in a separate browser or on your phone by using the hashtag HSCIOchat, or you can simply view the tweet chat in the Media Viewer panel on the right-hand side of your screen. We'll also be using the Q&A panel today. You can type questions in at any time as they occur to you. Send them in and leave the default set to all panelists. We will take them later in the program. And you can download the deck using the URL on your screen, and it'll also be sent out in the chat box. Just so you see how we're going to spend our time today, first we're going to go about 30 minutes with Galen Stockman, CISO at Franciscan Missionaries of Our Lady Health System. Then we're going to hear from our sponsor, represented by Dan Borgasano, Senior Product Marketing Manager with Imprivata, and then we are going to have our Q&A. So without further delay, I'm going to turn it over to Galen Stockman. Galen, thank you for joining us today.
Thank you very much for having me. So to get started, we're going to go over some things here about our implementation of Imprivata and how that happened. So this is an agenda about the what, why, who, when deployment challenges going forward. So Franciscan Missionaries of Our Lady Health System, which we refer to as FMOLHS because that's a mouthful, is a healthcare system in Louisiana. We're approximately 1,800 beds. Depends on which report you look at. We're either the largest health system or second largest health system in the state of Louisiana. We cover about 40% of the population here. Mainly central. Located in the Baton Rouge market. We're not in the New Orleans market, and west and north of us from a Louisiana standpoint. Technology snapshot to let you know where we're at and what we've got in place, and this is definitely not all encompassing, but Epic is our primary EMR. We're currently transitioning from Cerner in some of our markets, so we're half of our markets are live on Epic right now, and the other half are on Cerner, which will complete that process by the end of the year. Primarily a Windows shop. We do have some NIC systems and a few mainframes, but primarily Windows. We use AirWatch currently for our MDM solution. Of course, we use Imprivata in-house, and tied in with that, we use Citrix quite a bit. So, and I apologize if a lot of you guys that are on the call know this or not, but I want to go over what we consider MFA or multi-factor authentication or two-factor authentication. Basically, we refer to it as an additional verification of user's identity. We view this as at least having two of the three things, something you know. In our case, we're primarily, and most organizations are, we use a username and password for or something the user knows. Something you are, usually biometric, fingerprint, palm scans, retinal scans, things like that, and something you have, soft token, hard tokens. So we'll go over the technologies that we use in conjunction with that. So where were we before we had multi-factor authentication? We had our remote users were put in a particular AD group and OU where we allowed certain groups and certain individuals remote access, and we separated those by levels of access by what they needed. So depending on their access level, we granted them more privileges or less privileges. We only had basic user account methodologies for locking accounts on brute force attempts or failed passwords before we used the multi-factor piece. And then to improve our security, we felt like we needed a way to validate our remote access users, that they were truly who they said they were, and their account hadn't been compromised by threat actors. So why do we use it? It's an industry best practice. There's a lot of requirements. There's a bigger push for it across the industry. We're not leading the charge. This has been, we're actually probably behind the curve in getting it implemented. Other organizations are speeding towards this or have done this before us, and other ones are in process. We look at it as an added security for access into the system and network. It does provide the additional layer that we feel like we need in-house to protect network access and system access, because we want to protect our patients' information. That's our charge and our charter. At the same time, there's other repercussions with that. It reduces our cost of cyber insurance. I know on one of our recent cyber insurance calls, the first question that was asked by our underwriter was, do we have, or are we employing multi-factor authentication? So we do get a reduced rate on our cyber insurance, which is important because, like all healthcare organizations, we're trying to drive down our cost. Additionally, the big thing for multi-factor and using it is we need to learn from history. There have been a lot of high-profile breaches that have occurred, and they've occurred because of third-party access or even compromised credentials that the threat actors were able to gain a foothold into the systems. So the history's occurred, and we need to learn from that so we don't make the same mistakes and we can improve our posture. Selection criteria. So healthcare, has its own unique set of challenges. Patient care is first and foremost, and security is on the heels of that. And the things that we try to do from a security standpoint is to put in technology and controls that are behind the scenes the user doesn't know about. And sometimes we have to put in controls that I'm going to refer to as minimally invasive. Multi-factor authentication is one of those minimally invasive aspects because we're requiring the user to do something additional that they didn't have to do, and we can't be extremely transparent about it. So we're trying to ease that burden for our clinicians. We're trying to minimize the disruption to their workflow because they're in and out of the system constantly. We want them to have a smooth transition so that they're concentrating on patient care and not struggling or being frustrated with the technology aspect. That's important for us. Registration needs to be simple for the end user to help in acceptance, because with that registration, that's kind of setting the groundwork as into the end user's frustration or non-frustration. If they're having trouble registering, they'll get extremely frustrated. And we want it to be extremely simple from that standpoint, and those were our selection criteria based off that. So our clinicians currently have chosen Confirm ID for EPCS, and we'll go over that in just a minute. And so the MFA portion was a logical next step for us in there. So we currently use Improbata. There are many solutions out there. They all have their pros and their cons, and for us, the Improbata Confirm ID was a logical solution. Because I mentioned earlier, our physicians had already chosen for EPCS, that's e-prescribing of controlled substances, that they wanted to use the Confirm ID. Now, in saying that, we also use fingerprints for our clinicians as a part of that, but the process was there. So we went ahead and leveraged that, and I didn't want to give or require our users to have different multi-factor authentication applications that they had to contend with. We wanted consistency, uniformity across the board, and they're helping to eliminate the confusion on the user's end. So Improbata was a logical solution or choice for us based on our environment. But I will state that you always need to evaluate your environment. You need to check and determine the solution that fits, merges in with what you're doing. Some are easier, some are hard, depends on what you're trying to do. This one integrated extremely well, so and was from the end user acceptance was a logical choice for us. So when did we start implementing? So we staged our implementations. We started in May of 2017, and I mentioned earlier that we had different groups that we allowed to have remote access. So we staged those groups at different times, allowing them to register and come in and go live. Actually, our physicians were later getting on board, mainly because we're trying to ensure that we were communicating with them. But by August of 2017, we were able to basically fully implement MFA across the board with the organization. And it's been ongoing. We have a few questions occasionally, but it's been pretty consistent. We require everyone to use multi-factor authentication when they're accessing our system remotely. That includes our vendors, along with our staff and our clinicians, because it's our data. We have to protect it. So we're trying to make sure that people are all in line. We continue to implement. We're looking at internal implementation and anything else externally, and we've actually tried to reduce our footprint externally to a few points of access, and where we have those points of access, we've wrapped multi-factor authentication around that. So why did we choose this solution? So we currently use Tap and Go and single sign-on for Imprivata. The DEA requires MFA for EPCS. So in using that, and then what we've got with the fingerprint readers, the Imprivata ID soft token is a part of that, it made it a logical first choice and the right choice for us, like I'd stated earlier. There's learning and growing as we're going through the system, and our partner has been pretty good listening to our suggested improvements to the product, and it's continuing to mature. But I will say that for us, it was one of the easiest solutions for us to set up because of our infrastructure that we already had in place, and to get the users to enroll. And I've used a couple of these before, and this was extremely simple. Everybody's environment's unique and different. Ours just was conducive to this one, and we're extremely happy with it at this point in time. Deployment. So this can't be overemphasized enough, and having done this at different locations, communicate, communicate, communicate. Your staff needs to know, your end users need to know, they need to be aware of what's coming, and you need to start early on the communication plan. So when I mentioned earlier we started in May with a deployment, prior to that, at the first of the year, we already started a communication plan, alerting our users, letting them know what was coming, the reasons behind it. I attended different medical staff office meetings, prepping the physicians, meeting with them personally, and showing them what to expect and how things were going to work. That was a key to our successful deployment, was the communication aspect, and it can't be overemphasized enough. And also for the acceptance factor, we want, and there again, trying to make it as easy as we could on our clinicians, we allowed for push notifications. So when the user, all they have to do is pick up their cell phone and basically hit the approve button, and it allows them to get in. They still have the option of keying in the code, but our users, from the speed of access, especially physicians, they love the push notification piece. So right now we've got basically 4 aspects of the way we allow access into the network using MFA. Push notifications is the first one that we push and encourage to our end users. Now, there could be some slight risk for that, and we train them on that, because we train them to say, if you ever receive a push notification and you're not logging in, select deny. Do not do that. So, and then we allow for SMS text messages for them to receive that. So with the app that's on board the mobile device, there's a rotating code. And we also use hard tokens in certain circumstances where a cell phone can't be used, or there's policies surrounding that, and we'll discuss that a little bit further. So for us, some of the challenges was adequately communicating to the clinicians and remote users. We work with our marketing department and the medical staff office. Now we can handle our internal staff easier, but the physicians were sometimes difficult to get the communication to and get them to read it and understand it. So that's the reason we presented at meetings, and everything that involved physicians we had paperwork for them or messages to them so that they would know. Satellite offices proved to be a little bit of a challenge, only because some of the ones we talked to had a no cell phone policy. So the Imprivata app that we use is either hard token or cell phone, either through the app or text message. So that's our requirement, and they have to use that. I don't dictate to the staff offices what they're going to use as far as policy. That's not my job. That's their job. We can encourage them and say, look, you may want to make an exception, to do certain things or modify your policies, but in no means do we dictate that. And there's where the hard tokens come in some of those unique situations where some of the offices are just really steadfast on their policy. Some of our vendors, ran into the same thing, and they had to modify their policies because with the advent of cell phones, I can understand, people picking it up, taking pictures. But in reality, in a lot of cases, and sometimes physicians' offices or vendors will say we don't use it for security reasons. A lot of it's because it's a productivity reason. They don't want their users being distracted by Facebook, text messaging, and things like that. But there again, it's not our place to decide that. But those were some of the challenges and the questions that came up a lot that we had to address. So how successful was it? So most of our physicians use the soft token versus their fingerprint. So we track that usage from Imprivata on our logs as into who's using the fingerprint, who's using the soft token, who's using the code. So primarily we see most of the usage across the board with the push notification being used. This, like I said, speeds up their access, helps them in their process. So as a part of the EPCS, my CMIO, we were trying to get our e-prescribing rates up. And so as a part of that, he's an ER physician by trade. He said, as an ER physician, if I am going to have to prescribe something to my patient and say it's just amoxicillin or something like that, but then I have to prescribe them a controlled substance. If I can't e-prescribe and I'm going to have to write the prescription, I'm going to write it for both. So that's a frustration for the patient. We want to make things easier on the patient, a frustration for the physician. So actually, after we implemented EPCS, our e-prescribing rates went up across the board because now they were able to cover the controlled substance meds and the standard meds. And the patient liked it because when they went to the pharmacy, they didn't have to hand a paper prescription there. We didn't have to fax a prescription electronically, and they could go and pick everything up from that standpoint. So most of the feedback's been positive, especially on the push notification. With everything, you do have some naysayers, but for the most part, for us, it's been extremely positive. Like I said, contract workers, consultants, everybody that accesses our system remotely is held to the same standards. We require that. It's important that we have that consistency across the board. Like I said, we are in charge of protecting our data, and it's important. So my suggestions to you guys to be successful, in your deployment of multi-factor authentication, regardless of which product you go with, communication. Start early, start often, have face-to-face meetings if at all possible. Elicit your marketing staff, your medical staff, anyone you can to help get the message out. So a lot of times staff gets swamped with messages, and sometimes it gets lost in the translation. I will say, for the Imprivata product for us, the system was so easy to register, even though when we gave the communication and we said, here's what to do, here's what to expect, things like that, that when they went in to enroll and register, it was self-explanatory. In other words, if they could just if they read the stuff that's on the screen in front of them, it walked them through it step by step and took probably 2 minutes of their time. But there again, we still, regardless of that and how easy it was, we did push the communication piece. Pick the solution that works best for your organization, on your integration piece. For us, it made sense. It integrated extremely well and easy for us in our Citrix environment. We didn't have to do a lot of changing. With some of the other products we looked at where we're going and the way we were going to deploy things, we were going to have to change our remote access setup and for our end users, and that was going to cause more headache in the long run for the end user and for the technical team because it was going to get extremely complex. The one we chose, like I said, and for our case, worked well for us. It was extremely easy to implement and focused on our needs as an organization. So when you're looking at that, evaluate that across the board. You need to understand that and the impact on your technical team as well as your end users too. Making the process simple to register and use is key to the success, in my opinion, of the product, of any product at least, because the end user, and especially clinicians, their first and foremost job is to take care of patients, and when you're swamping them with additional requirements, it needs to be extremely easy and simple. And a lot of the questions that we have sometimes are just minor things, but like I said, it's overall our tickets, we hardly have any tickets now from our support staff with a multi-factor issue. Stay focused on implementation. Don't give users a free pass. If you start that, news travels fast, and you'll go down a path that's hard to get back from. I had to buy in from a lot of the senior leaders, all the senior leadership. So we stayed the course. Initially we had some hesitation against our third-party vendors that access our system remotely for billing and things like that. We ran into some initial hesitation there, but we stayed fast and strong on it and said this is a requirement for doing business with us, and they've accepted and gone forward. MFA is not a silver bullet. It's a strong tool. But, as a security professional, we can't ever rest, but if you're listening and you're, implementing multi-factor authentication, it is very strong. It does do a good job, but it doesn't correct for everything. And if, like I said, the push notification piece, we gave out additional education on there because it could provide a risk to us if they just pushed OK and approve without knowing that they were the ones logging in. So that was, additional education piece that we stressed. But however you do that, like I said, it's, get something that's going to work for you and you should be successful. Anthony, that's it for me. That concludes my talk. Back to you.
Very good, Galen. Well, thank you so much, and we are going to look forward to a little Q&A with you in a few minutes. So at this point, we're going to hear from Dan Borgasano with Imprivata. Dan, thanks for joining us, and thanks for sponsoring.
Great. Thanks, Anthony, and thank you, Galen, for that presentation. Hello, everyone. So before we do open it up for questions, I just want to provide a little bit more detail on Imprivata Confirm ID, which, as Galen mentioned, is the solution that they're using for multi-factor authentication, both for remote network access as well as EPCS, or electronic prescribing of controlled substances. So we know you have a lot of options, as Galen alluded to, that are out there for multi-factor authentication, but there are certain considerations for healthcare that it's really important to keep in mind as you evaluate different solutions. First and foremost is the efficiency for your users, and Galen talked about this quite a bit, but you want to make sure that as you add these layers of security for your users, particularly your clinical users, you want to make it as seamless and easy and as efficient as possible so that you can continue to enforce second-factor authentication across a broader set of workflows without getting in the way of patient care and without leading to user frustration and lowering adoption and dissatisfaction. The second consideration is the extensibility to meet all workflow needs. As Galen mentioned, they did not want to give different authentication solutions and use different vendors for different workflows. They wanted one consistent option, which is both easiest for end users as well as easy for the IT staff to manage. And so in healthcare, that means specific workflows such as EPCS, and there are some other clinical workflows that you may want to add that second factor of authentication. And ideally, that again is all from that single centralized solution. And then finally, in healthcare, we're dealing with certain requirements, certain compliance requirements that don't exist in other industries, particularly EPCS, which I'll talk about in just a minute. So another consideration is, can this solution help me meet these compliance needs? Because if it cannot, then you're likely dealing with either needing to acquire a second solution or put certain manual processes and things in place to meet those additional requirements, again, for example, EPCS. And really, Imprivata Confirm ID is designed as a platform to address all of those considerations. So from a single enterprise-wide platform, you can set all of your different authentication policies across all of your different business, admin, IT, and clinical workflows. This hopefully will help you reduce your total cost of ownership and really make reporting easy from a security and auditing and logging perspective. And importantly, you can eliminate needing to deal with multiple different authentication vendors and different methods for your end users to make it very easy to use, and for IT, very easy to administer and manage. And importantly, Imprivata Confirm ID is designed from that clinical perspective. We really want to make that security invisible to the end user by making the authentication very fast and very convenient. Galen mentioned fingerprint biometrics as well as the push notification that we have, but I'll talk about in a moment a couple of other options that really are going to give you the flexibility to select the authentication methods and combinations that are best going to meet your users' needs depending on which workflow that you're trying to solve for. We also offer nice tight integrations with EPCS workflows, with your VPNs, with Microsoft ADFS, and with a number of other applications and systems and workflows so that that authentication can be presented to your users right within the context of their workflow. And again, it's just a small, seamless extra step that's going to add that layer of security and compliance without inconveniencing the end user. And by doing this, by allowing you to add a seamless layer of security and authentication across a broader set of workflows, you'll really improve and increase your visibility into all different interactions with patient information and other sensitive hospital information, which will really improve your security overall. So for remote access or coming in through, a VPN or other gateway, Imprivata Confirm ID is going to allow you to add that second factor, which is the push notification that Galen mentioned. And really, this can be extended not only for remote access, through your VPN, but also to access your cloud applications if you're moving to Microsoft Office 365 or Outlook Web Access or some others, and as well as give you a second factor for your IT administrators who are accessing your Windows servers and your remote desktops if you want to enforce a second factor of authentication for those workflows. Confirm ID is going to give you one solution to meet all of these different workflows, and again, it's a very fast, very consistent, very easy push notification so that that authentication is simple for all end users. And this is going to allow you to address all the increasing security threats that we see, particularly those that are targeting your users' credentials. In fact, roughly 85% of all outside attacks are the result of stolen or weak passwords and other credentials. So that's why we're seeing phishing and other highly targeted attacks designed to steal those usernames and passwords. If we can add that second factor for a lot of these workflows, then we really mitigate the risk of stolen credentials. Now, for EPCS in particular, there are a host of specific requirements that the DEA has that you're required to meet before you can enable EPCS or electronic prescribing for controlled substances. Two-factor authentication at the time of prescribing is just one of those steps, and that's where the authentication piece comes into play. But there are identity proofing, enrollment, credentialing, and then auditing and reporting requirements that the DEA has that all need to be in place before you can enable EPCS. So Confirm ID is also designed with that in mind, and it's designed to be an end-to-end solution that is going to help you meet all of these different pieces, all of the different requirements for EPCS, in addition to that fast and seamless authentication for your users. That's why it's really important, if you're looking at EPCS as part of your broader multi-factor authentication strategy, to understand all of these specific requirements you're going to have to meet and how Imprivata Confirm ID can help you meet those, because as I mentioned, otherwise you're going to be forced into a situation where you'll have to figure out sort of disparate technologies and processes and systems to try to piece together all of these different requirements, which can leave security gaps and compliance gaps as well. So finally, very importantly, as I mentioned, Confirm ID as a platform is designed from that end user perspective. We really want to allow you to add second factor authentication across all of these different workflows in a way that doesn't disrupt workflow or patient care, and is very easy for your end users, particularly your clinicians. So first, we do that by taking away passwords in some cases or supplementing passwords with a stronger authentication. But we offer the broadest range of convenient and innovative authentication options, many of which are DEA compliant for EPCS. So this is really going to do two things. First, it'll give you the flexibility to enable the different authentication options that are going to be best for the different workflow requirements. For example, for EPCS, in your busy ED, you might want to add those fingerprint biometrics along with the token to take away the password requirement and allow your physicians to complete that workflow very quickly. However, that same physician who needs to prescribe from home likely doesn't have a FIPS-compliant fingerprint reader at their home laptop, so they need another set of authentication options. In that case, you can use a password plus the push token that Galen alluded to. So that's really going to give you the flexibility to use whatever combination is best, but it also gives you redundancy, so you have backup options so that your providers can always have an EPCS alternative available to them. For example, they're in the busy ED, you have fingerprint and push token enabled, but they've forgotten their phone in their car. So it will recognize that and it will default to password plus fingerprint. So again, really a way to make it very fast and very easy and convenient for your users, and still allowing you to maintain that level of security and compliance to meet these workflows. So with that, Anthony, I'll now pass it over to you for questions.
Very good. Thank you, Dan. Appreciate it. Looking forward to our Q&A now. As I mentioned, go ahead and type your questions in now and send them in the Q&A box. Galen, first question that's come in, how many total users were activated?
We have about 8,000 users that were activated.
Okay. Is that it sounds like a pretty big number. Did that present, does it depend on how many you're doing in terms of how complex this is? The bigger the number, the tougher the project?
In our case, no. For us, at least, it wasn't a numbers issue. So we have X number of employees, but then we only grant X number of employees, vendors, remote access. So not all of our employees, access our system remotely. So we concentrated on the ones. We didn't find it any more difficult, if we had to do 20 versus, like I said, 8,000, because the process was the same, the way we had it set up and streamlined. So for us, if it had been 20,000, the process would have been the same. The biggest issue would probably have been just trying to make sure we communicated to everyone.
Yeah, you mentioned communication quite a bit. Pretty much when you talked about the technology, you mentioned how easy it was. And when we talk about people, a little bit different, a little more challenges there. Is that the correct way to describe probably any IT project, but this IT project?
Always, yeah, especially in healthcare. So security is not always the biggest fan of our staff. So we try to embrace them and explain. So part of the communication was explaining the reasonings behind it. So if we had organizations or group that basically were providing pushback, using real-life things were happening in the paper and things like that to explain it, the light bulb turned on. They got the message. Like I said, not for everybody, but for the majority of people, yes. So communication, to the users, whoever's going to be affected by that. If you do that adequately, at least in my experience, you'll have good success, hopefully.
And did you have some of those people who, though they were explained to them, here's why we're doing it, we're making it as easy for you as possible, they still sort of wanted no part of it? Those surgeons, those doctors that they don't want to hear from anyone in IT about anything. How did you deal with that?
Well, I'll give a real-life example. So I was lucky. So I was in a meeting with surgeons. So surgeons, have their own unique challenges and speed and time and things like that. So I had two physicians say, it's going to take us a lot of time to do this, and I didn't pay the other physicians. I didn't even know they were going to say anything. I had other physicians pipe up and say, look, guys, it's simple. It only takes 2 seconds. But if it took longer, we couldn't, with the product, we wouldn't have been able to do it because clinicians need to get in and out. So we wanted to address those concerns. But for the most part, like I said, everyone's on board. I haven't heard any complaints. And if they had some issues, our team worked with them personally to help them over their issues or fears or whatever, and showed them the process. And that did wonders for us because we try to give a hands-on experience when we got the service tickets in to the end users. Some organizations, depending on the size, can do that, may not can do that, but it does help.
So talk to me about that sort of dynamic. As a security professional, you need to put certain tools in place that make your enterprise more secure. You have to look at those tools and you have to say to yourself, this is going to require X amount more time. And you have to say to yourself, I think, or talk to others or say, this is reasonable. To ask for this in exchange for this level of security is a reasonable request. You just mentioned that in this particular case, if the requirement to do this took longer, maybe 1 second longer, maybe 3 seconds longer, that throws the equation out of whack. Is that true? Is that how you look at these things?
Yeah, so it's a partnership with, especially with the CMIO and the CMO for the system. We had them go through it, participate in it, experience it, because we wanted their feedback. Is it too long? Is it fast enough? All with technology, anytime you add an additional mouse click, push click, things like that, that takes time away from the physician. And they'll tell you that as they go through a day, they may spend an hour and a half or more logging in and logging out of systems, which takes away from patient care. So that's important that we reduce that time slice down, that it's up, it's highly available, it has to work, and it has to work expeditiously. So yes, it's a key component.
And you mentioned the CMIO, the CMO. Let's also bring in the CIO here. Just talk to me about, as the CISO, those important relationships and what each one brings to the process.
Sure. So, at least in our organization, each of us are on different committees. Some are joint, some are independent. So having them knowledgeable on the product of what we're trying to do from a security focus and be able to articulate it in that to their group that they're talking to, of course, I'm always available for that. It's important for us to help, in other words, sell the message to the end user. So, having the buy-in of the stakeholders, especially the lead executives, is crucial. So they were all on board. We showed it to them, we demonstrated it to them, and they thought, okay, it was pretty good. But then when you get down to the clinician level, we need to make sure. So we had our organizational corporate CMIO and CMO. I engaged also our local at our facilities that we have dispersed, the local CMIOs and CMOs. I had them a part of the pilot program initially to get that feedback and understand it. And once we got the green light from them because of the way we implemented the product, then the communication and the executive leadership, they were able to disseminate the information, explain the why for us as they were talking to their peers.
Very good. All right, question from the audience. How are you addressing the newer concern of theft of biometric data? as in having your biometric database information stolen and then used to access your system. Is that something you're thinking about?
Yeah, we're always thinking about the the biometric piece, and we want to be careful with that. But like I said, it's even through the EPCS portion, and there's checks and balances there, separation of duties when we set those up from an EPCS. That's the only place that we're using the biometric piece. Is in the EPCS portion. So we try to make sure that the access in the database that covers that is extremely tight. Now, you always have to worry about insider threats too, along with external threats, but we definitely want to protect that as much as possible. Although, like I said, the trend and the analysis is that since most everybody in this day and time has a cell phone with them, we find that trend of them using their cell phone more versus the biometric. And another reason for that too is physicians and clinicians wash their hands a lot. Even though we've got FIP certified biometric machines, sometimes if they're greasy or something, there may be an issue, and they don't want to be frustrated. And we can tell how many times they're trying. But in most cases, we see them opting to the push notification just for, it seems to work in their workflow, seem to be a little bit better.
And I think this next question touches on that. Are you finding any resistance from users to use the mobile application for the push token? And if so, how do you deal with it?
We have had some pushback for using the mobile application because a lot of people think that, okay, it's a cost to it, which it's not. It's free. It's going to use their data plan, which if it uses data, it's minute by any stretch of the means. And sometimes they're concerned about the application itself, using data, and we've explained to them that it's self-contained, it's tied to the device, it doesn't have to basically communicate out. So usually once we get through those, we talk about it. So depending on a user's cell phone plan, if they say, no, I want SMS text message, they may be charged for that. With at least the push notification in the app, if they get that, then there's no additional cost or charge to them. So for the most part, we've been successful in explaining that to them, and once we've explained it to them, they usually come on board and say, okay, that's not what I thought it was. And there again, that may have been a failure to us to adequately explain as we're pushing out the implementation about, oh, here's some things, and we try to update a question, frequently asked questions about, okay, what's this do to my device? Do you track me? Everybody's worried about somebody tracking them. No, we don't track you. We don't care to track you. Things like that. And once we can explain that to them and put them at ease, then they're in a better position.
Very good. Anything you want to add about enrolling users, specifically clinicians, for the EPCS product?
So I mentioned earlier, so that's a separation of duties. So my security team, basically, we activate within the system that they can have EPCS functionality. So there's an application piece within our EMR that says this clinician is allowed EPCS functionality. The medical staff office, in our case, then does the vetting because DEA requirements, that they got to vet and verify their identity of is that their fingerprint, is that their token, and is, since each token application has a unique serial number with it, that they confirm that belongs to the physician. They have to bring their ID and all that good stuff from a DEA authorization standpoint.
Very good. The opioid epidemic and EPCS, it seems like a good time to be coming up with a solution with all the national attention on that problem. So does that make it an easier sell?
I think it does. So what we do, and our pharmacy is involved in this too. So our pharmacy reviews the records also of EPCS prescriptions. That's their job. We're not, although I may know some clinical stuff, it's not our job from a security focus to do that. From a security focus, we look at failed login attempts. So if somebody's failing a login attempts, we're trying to see if they're trying to, one, abuse the system, brute force, or anything else on what the issue is. So we do have a threshold there before we have to, tag on and communicate with the user personally and say, okay, what are we trying to do? What was the issue? Can you explain that to us? Pharmacy, there again, reviews the data of what the physician's doing, what they're prescribing, and they make the call on whether that's, exceeds the dosages or is too much, or if somebody happens to be, prescribing a lot of, opioids for that example, is it in their role or something they do as a part of their job? So they handle that aspect.
Very good. Just as a final question, you talked about your infrastructure and how in the Citrix environment, how it made implementation easy. Any more thoughts around that? You just get lucky, or you set it up pretty well from the start?
So we had a few minor changes with the technical teams, but not much. Like I said, we evaluated different products before we settled on Confirm ID. And the way we have our Citrix environment set up, if we were going to, as we had our long-range plan, we were going to have to completely change our infrastructure, the way the environment was set up, if we went with another product, because it wasn't going to easily accommodate. The way we do it on the Citrix side is based off groups. So if you're in the group, you get multi-factor. If not, you only get one thing. Basically, it's kind of like getting into your own personal bank account, the access, because the access into the network is what we're concerned about and protecting our data. Now, like I said, at some point in the future, we'll continue to review that, and says, depending on the access level, whether we do it for everyone or not. We're also, but the Citrix environment that we have set up, it went in extremely well. Was not much to modify from what the engineers tell me that they were working on it, and basically made their life a lot easier. It reduced the complexity.
Excellent. Wonderful. Well, that's about all we had time for today. When you close out your WebEx window, you're going to be taken to a post-event survey. If you could take a moment to answer that, we'd appreciate it. Regarding continuing education credits, for those of you who hold the CHIME CHCIO certification, attending our webinars gets you 1 CEU. Let CHIME know you were here, and if you've asked us to do so, we will. If you need a certificate of attendance for another CEU program, you can use the final slide in this deck. You'll receive an email when this event has been posted to our YouTube channel. If you'd like us to produce a webinar on the topic of your choice, you can contact our Director of Sales and Marketing, Nancy Wilcox. You can go to our website to see our upcoming schedule of events. So with that, I want to thank our sponsor, Imprivata. I want to thank Galen Stockman and Dan Borgesano for speaking today. And I want to thank you, our attendees, for supporting our events. With that, everybody have a wonderful day. Thank you.